If you've ever had serious surgery or had to navigate periods of pain, your doctor might have prescribed you opioids. Opioids are synthetic chemicals that interact with your nerves. The goal is to help you manage and hopefully reduce your pain. However, opioids can be very potent and dangerous, and experiencing an opioid overdose is possible. An opioid overdose involves taking so much of any opioid drug that you're at risk of doing permanent harm to yourself. Now, if you take opioids exactly as prescribed, it's very unlikely you'll experience an opioid overdose. However, if you mix an opioid with other medications, illegal drugs, or alcohol, an overdose can occur. Sometimes opioids are added to illegal drugs secretly, so people don't know they're taking an opioid until it's too late. An overdose can also be fatal when mixing an opioid with a medication that's prescribed to treat anxiety and insomnia. Taking too many opioids suppresses your breathing. Most people who die from an opioid overdose do so because their brain and heart aren't getting enough oxygen. If you're having trouble waking someone up and they have very small pupils, call 911 immediately. There are 3 major signs of an opioid overdose. 1. Sedation. Someone is either very sleepy or maybe they've passed out. 2. Improper breathing. Someone's breathing might be shallow or slower. 3. Along with these signs, both eye pupils resemble small pinpoints. After calling 911, follow these 3 steps. 1. Give them a drug called naloxone if you have it, also known as Narcan. This can reverse the effects of an opioid overdose if given quickly. 2. Try to keep them awake. 3. Lay or roll them onto their side to make sure they don't vomit. And above all, stay with the person until EMS arrives. Quick action is important if you come across a person having an opioid overdose. Knowing the signs and symptoms to watch out for just might save someone's life.